Hi everyone, welcome to another mini talk put on by the Cardiovascular Prevention and Rehabilitation Program here at South Lake Regional Health Center. This week we are going to be talking a little bit more about flexibility and stretching. It's going to be short and sweet, not too long, and so we are going to get right into it. So in this session today, we're going to look at some of the different ways of flexibility and how it can be beneficial towards us. And then we're going to talk a little bit about how we can practice it and improve our flexibility and get even better. So first off, let's start with something really formal and let's think of what a formal definition is of flexibility. So what is it? What is flexibility? What does the word mean? What does it consist of? Well, flexibility is a term that's used to characterize what we call pain-free range of motion. It can be pain-free range of motion in a single joint, so maybe an elbow, okay? So moving my elbow without any discomfort, that's what we classify as flexibility. Or it could be a series of joints. So it could be something that maybe that you have certain muscles in your body that cross multiple joints. So for instance, you have lots of muscles that run all up along the back, okay? And any movement of the spine, whether it's flexion or bending over, extension, leaning back, any sort of twisting motion, that requires your muscles to be able to move. And any movement that is pain-free, that's what we call flexibility. So you can train your body. There's such thing as what we call flexibility training, and that is a systematic program of different stretching exercises that are specifically designed to progressively increase the range of motion of your joints over time, so that you are able to move in a full range of motion as opposed to just a small range of motion and kind of be restricted by your muscles. So we want to know what the benefits are of stretching. So first off, stretching will help contribute to efficient movement in all of your daily activities. It helps increase and improve your body's awareness in space. So knowing exactly where your body is in relation to the surrounding items and furniture around you. And that's a key component in making sure and maintaining your balance and coordination. If I were to say that we weren't able, or we wouldn't be able to walk as well if our legs, say if our knees aren't able to get full extension, if they aren't able to straighten out as much as possible because we're not flexible, then walking will be a very difficult task for us to do. Stretching also helps with reducing muscle soreness. So sometimes for those individuals that like to exercise and like to exercise quite frequently, our body essentially is breaking down its muscle tissue into breaking down and stretching out those fibers, those muscle fibers, and to reduce the amount of soreness that is associated with that, regular stretching, regular flexibility training will help alleviate a lot of that discomfort. And then the other thing is that, again, you want to maintain your range of movement, especially as we're aging, to make sure that you're still able to do very typical daily tasks. And so if you do not have flexibility, if you have a lack of flexibility, then most often it's associated to developing some acute or more chronic long-term injuries or even repetitive trauma, and a most common one is low back problems. So that's why if we want to avoid that, regular stretching will incorporate or will enhance a lot of things in your everyday life. So lots of people know what's in it for me, okay? And essentially, if I was to paint a picture of why flexibility is so important specifically for you, is that your muscles are made up of what we call connective tissue. And as we age, they become less elastic. And as you age, you become more sedentary. Physical inactivity is a big factor here. And essentially, it's just the same cycle of you get older, you do less, you then become stiffer, then you get older, you do even more less, and then you become stiffer. It's this toxic cycle that we eventually want to break. So essentially with inflexible and older individuals, it's natural for muscles to become more stiff, and you have a lower stretch tolerance. Your muscles don't stretch as well as they used to compared to a younger individual with what we say normal flexibility. So as our muscles stiffen even more and more, our flexibility essentially declines and decreases. And it's most often associated with a lack of physical activity, and oftentimes in older individuals, arthritis starts to develop. So with a combination of not being physically active, and then you have arthritis discomfort that comes on, it's just this toxic cycle of, you're not being active, you don't do much, your muscles get stiff, and the more inactive you are, the less you do, the stiffer your muscles get, and that restricts you from being able to do a lot of typical daily tasks throughout the day. So we do recommend that you stretch as often as you can, okay, as much as you can, anytime during the day, ideally after you finished your exercise and are cooling down. That is when you'll find that your muscles respond best, when they're warm. So if I was to paint a picture for you and say, well, what happens if you had an elastic band that was in the freezer for weeks and months, and then you take it out of the freezer and you go and stretch it? Well, most likely that elastic band is going to snap. Okay, your muscles are not exactly an elastic band, but they have very similar properties in that if your muscles are cold, they can be damaged and they're not going to stretch as well. So stretching when your muscles are warm after a walk or after an exercise session, that will be so much more effective for you, and it'll feel a million times better. So where do I start? What kind of stretching should I look to do? What should I start to consider? So when we say stretching, what that means is it involves holding a certain position beyond what your normal resting muscle length would be. So if I was to say that sitting is a stretch, well, not really, because our muscles naturally, move that way or are positioned that way. But if I was to say, for instance, stretch out my shoulder, okay, if I know this is what normal length of my muscle is, if I was to stretch even higher, okay, I know that I'm lengthening my muscles all down my side and a little bit in my back. I'm lengthening my muscles. I'm able to do it without any pain. That is the key word, pain-free range of motion, but it's beyond what I normally would be able to do. When you're stretching, okay, what's really important is that we don't want to bounce, we don't want to jar, we don't want to rock back and forth while you're stretching, because actually that can bring on or increase the risk of injury if your body part, if your limb is forced beyond its normal range when it's not yet ready to do that. Okay, so when we're in a stretch, we want to hold that stretch in a very specific position and focus on just relaxing the muscle as much as you can. Some people do have questions about, if I can do stretches where my, I'm touching over and leaning my toes, things like that. What I would recommend for most cardiovascular participants is that try to keep your head above your heart. So you don't want to be with your head all the way down at your toes, okay? You can still get a very great stretch from a seated position. You're still stretching the exact same muscles as if you were to be touching your toes, but you want to have your head always elevated, and that's mostly to avoid any drastic changes in your blood pressure. So feel free to use the assistance of a chair or something stable beside you so that you can always hold on. And again, there are thousands and thousands of different stretches that you can do. So if you're finding that you're not feeling a stretch in one certain position, then don't be afraid to ask your exercise therapist, and they can definitely provide some alternatives for you that are a little bit more comfortable and you might feel a little bit steadier on your feet. So with flexibility training, we still want to make sure that we are hitting all of the major muscle groups of the body that we work out in our resistance training sessions or when we're doing our aerobic, walking, cycling, whatever it might be. We want to make sure that when we do our stretches, we are doing a stretch, at least one stretch for each of the exercises that we devote to, each of the major muscle groups, rather, that we focus on throughout our regular programming. So how do I improve? You know, am I stuck at this flexibility? I can't touch my toes. Am I ever going to be able to touch my toes? Well, I can't say that for certain for everyone, but there are ways that you can improve how flexible you are, the stretchiness essentially that you feel. So again, you want to focus on the target muscles, the big muscles involved in the stretch, and we relax the other muscles that aren't really being partly focused on. Essentially, I would recommend that you do some sort of stretching at least 3 times a week, okay? Older people, older adults should be encouraged to perform, you know, more often because we know that age is associated with less flexibility, so don't be afraid to do it more often than 3 times. We do recommend that for each given stretch, you want to hold it for about 10 to 30 seconds, okay? And again, no jarring, no bouncing back and forth, just holding in a specific position for about 10 to 30 seconds. And if you're an older adult, the recommendation for you is a little bit longer, 30 to 60 seconds, just so you can get a little bit more out of that stretch, okay? You can repeat each stretch about 2 to 4 times, okay? But to make sure you give yourself about a 30-second break in between stretches. So for instance, if I was to do something as simple as stretching some muscles in my upper arm, okay, and I pull my arm to my side here, I want to hold that for about 10 seconds, okay? I'm not going to jar, I'm not going to bounce back and forth. I'm just going to hold that for 10 seconds, okay? And then I'm going to relax for at least 30 seconds. So sometimes what some people like to do is that they will alternate arms. They can put the other arm up for about 10 to 30 seconds. And then when they relax, when they reach that break, they break down, and then they go back and they repeat the first arm. Okay, so give yourself a little bit of time. Most often, if your muscles are held in a very stretched position, they can actually potentially spasm because they're being, you know, there's such demand on it to stretch to such longer lengths. So definitely give your muscles a little bit of a shake in between and then go back and repeat. So that's it for the kind of the theory behind flexibility and stretching. It's really important that you incorporate that on a regular basis in your regular routine. Again, try to do it at least 3 days a week, doing different stretches for different body parts. Be sure to check out our session that demonstrates various stretches that will help get you started. If you're not too sure which ones to do, keep an eye out for our video of different flexibility exercises or stretching exercises that will help with that. Okay. If you have any questions, don't hesitate to reach out to our program email, which is cardiacrehab@southlakeregional.org. We hope you have a great day, and we can't wait to see you at our next mini talk. Thanks.